Hi, our presentation is on health promotion for survivors of sex trafficking.
My name is Anna.
I'm Lauren.
I'm Jennifer.
I'm Allie.
I'm Maggie.
I'm Grace.
And I'm Marcella.
So starting off, we're going to be talking about sex trafficking, and the working definition that we will be working with is commercial sexual exploitation of children, which is defined as any activity where the child is treated as a commercial and sexual object to be used, sold, or traded in exchange for something of value. So the population that we specifically looked at is female victims under 18 of sexual exploitation in the urban, suburban Portland area. We chose this specific area because they have a high number of sex trafficking victims within this city. A few of the reasons why there is such high numbers here is because there is high rates of homeless youth within this population. The placement of the city along the I-5 corridor makes it very easy for traffickers to both take victims and to exploit them within for profit. There also is a lack of known resources within this area for victims, and also there's cultural considerations within Portland itself. Specifically, Portland has the highest number of strip clubs per capita in the United States, which this leads to a culture of sex for money, which can lead to a demand for sex trafficking.
For one of our key informant interviews, I got to talk to Joanne Wilder, who's one of our adjuncts here at Fox. You all probably know her. So while she doesn't have specific experience with individuals that have been sexually trafficked, she has a lot of experience with trauma-informed care and how that plays a role in just caring for and being able to see people in that way and care for people in that way. So one of the things we talked about were the vulnerable populations, and how in addition to those sex trafficked, it's also homelessness, immigrants, runaways, and LGBTQ plus people. So how she has a lot of experience specifically with immigrants and runaways from doing her neighborhood organization in Arizona. So we talked a lot about the barriers that there are to care and how those barriers really do keep a lot of progress from happening. Those being shame, how there's a lot of shame and there's a lot of stigma behind sex trafficking and the sex trade. Another one being systemic brokenness of laws, and how a lot of the laws in our societal system are very much favored towards the abuser instead of the abused, and how kind of keep people in a cycle of not really, like, if you don't have privilege, then those laws are not going to work in your favor, and how that systemic brokenness is really just another one we talked about was the control of money, and how if there's an individual that does not have control of their money, does not have control of their identity, then they're just kind of stuck, and that's another huge barrier to care. Once again, and another is the lack of insurance, so not really having the capabilities or the resources that they need to get out of a very traumatic space. So one big thing we talked about was just how long-term care and being kind of care for the long haul is really, really important with this population. I asked her what she thought would really make a difference for this population. She said, well, I think individual care really is good, but what real change will come from is long-term interventions. And basically it kind of boils down to changing that systemic brokenness of laws and the systemic brokenness of racism and biases that we have in our society, in our country, and that the care for this population really, really needs to be long-term because there's not much consistency in their lives. She said this quote, which I really, really enjoyed. She said, trauma-informed care is about covering rather than exposing vulnerable people. I thought that was really moving, and how important that is that we are going to be nurses and we get to give autonomy and give choice and give freedom back to those individuals that really have been stripped in a lot of ways. So, yeah.
Our second key informant interview, I was able to interview Mike Mercer. He is the CEO and founder of Compassion First. Compassion First is a nonprofit organization that was founded in 2007, and their goal is to provide long-term solutions and hope for survivors of child sex trafficking and exploitation. So they work to provide aftercare for survivors. They also really work hard to partner with law enforcement and also to work to provide just prevention and to partner with the community in building programs and to partner with others in the community as well. When I was talking with Mike, I wanted to ask him about what the main health disparities that they bump up against are. And so they, Compassion First is based out of Indonesia. They have, their offices are here in Portland. That's where they started out of, but they actually do all of their work in Indonesia. And they have a house called Sarah's House, which is where the girls that they rescue go and live. And they do a full physical workup on the girls there. And they time and time again run into these problems of STIs and HIV there. And he said poverty is the #1 informer of sex trafficking there. So it's oftentimes girls that are looking to get out of poverty, or where they become desperate, they're in desperate circumstances, or people kind of can target them for recruitment. So that's kind of where you find people in poverty. That's where you can find them kind of leading into a life of trafficking. So that's where their team is working to try to put places for prevention. That's where they're working for community building. That's kind of where they're working to try to help with trafficking down there in Indonesia. And he also was talking about recidivism. If there's not good wraparound care, if they're not able to come around these girls after they've come out of a life of trafficking, a life of living in prostitution, of different things, if there's not good care, then they're likely to go back into to this life after they've oftentimes been rescued. It's kind of this cycle. We talked about the cycles of abuse. It's kind of the similar thing in sex trafficking. So that's another thing that their team is doing down there in Indonesia, is trying to help break that cycle. And for them, legal intervention and police partnership are really crucial. They have a good partnership with the police down there, working to help try to rescue the girls and try to build a good partnership there. They want to be on good grounds with the police down there. Some resources and interventions that he mentioned being really crucial are using good therapeutic communication and therapeutic techniques, having good social services and family support, making sure that you can pay to have good case coordinators, and then having good opportunities for economic development, both for his team and staff, and also for the girls as well. He said it's important to have good economic resources for his staff, because if you can prevent staff turnover, the girls there will trust him more, and they can also just have a better team as well. And in 2015, Mike and his team were able to launch something called Safety Compass, which is a local advocacy organization actually here in Oregon. It's in Multnomah, Washington, Clackamas, and Marion counties. And this is essentially a resource that works for advocacy and prevention just in the Portland kind of area. And they offer in-person support, training, education, and a lot more services for survivors, for law enforcement, and for social service providers of sexual exploitation, of trafficking. And so Mike actually stepped back from that when he realized it was too much on his plate, but now that's just a service that's thriving here in the Portland area, that's available for survivors. Another thing that Mike made really clear when I was talking with him is that the need profile for a girl that's trafficked in Indonesia isn't really that different from a girl that's trafficked in Portland. The resources that we use to meet those needs are the things that will ebb and flow. And a lot of those interventions that we're using are the things that will stay the same. The therapeutic care that we're providing, the utilization of social work, the case managers, the reality of trauma and poverty that these girls are facing, and the health disparities are the things that will remain true across the world, and for most survivors of sexual exploitation and trafficking.
Okay, so for the assessment of our project, we found a few resources that are in the Pearl District of Portland, and together all of these resources offer support, intervention, advocacy, tangible, and rehabilitative services to child survivors of sex trafficking. So below, these are some of the resources that we found. I'm going to talk about the Oregon Abuse Advocates and Survivors in Service. This organization is built by survivors of sex trafficking, which is really interesting. So they are able to have a perspective that's personal to them. And they're committed to taking strategic action towards making a difference in the Portland area. They have a speakers bureau that advocates for a collective understanding for change in Oregon. And then the next organization that I'm going to talk about is Door to Grace. And this is a nonprofit organization that was created by a group of Portlanders who recognized the need for advocating for children that were sexually exploited. So this organization creates a group home space for these children to foster family and community. And this group home has all of the necessary parts of a healthy home. So a kitchen, a dinner table, home meals, trusted and familiar faces, and they actually invite people from the community to come who have good rapport with this organization. And they come in, and the children who are living in this home are able to create a family with these host families. So that's really cool that they're able to go out into the community after being in this organization. So all of these organizations are creating interventions specific to this population to decrease the rates of homelessness and sex trafficking in the Portland area.
Our short-term goal is to increase the engagement of STI prevention and treatment services. So this would look like increased rates of sex trafficking victims pursuing either testing or treatment over the course of the next 6 months. And this goal is in line with Healthy People 2030, as one of their stated goals is to reduce STI and their complications, as well as improve access to quality STI care. And our primary intervention would focus on education and prevention resources. Within this, the nursing role would be as an educator and an advocate, and this could be accomplished through free condoms in public health offices or food banks. And then another way of reaching this goal would be by increased availability of screenings with the goal of preventing further infections. And so the nurse would be acting as a clinician, and this could be accomplished by partnering with public health, public safety, and public transportation, by advertising testing near adult entertainment businesses or other places that sex workers may be. And then finally, improving access to treatment, and this would be made available by public health, and the nursing role would again be as a clinician, and this could be accomplished by having appropriate contact information specific to the patient at the time of testing or screening. And so since each patient scenario might be different and they might have limited ways to be contacted, this may look like just setting up a follow-up appointment at that initial testing time. And this can be accomplished through partnering with public health and local healthcare affiliates, including Planned Parenthood. And so by providing increased education and resources increased screening, as well as increased availability of treatment, we hope to lower or increase the engagement of testing and the treatment for STIs in order to lower the incidence of STIs.
So our desired long-term outcome is an overall decreased rate of homelessness for victims of survivors of sex trafficking in the Pearl District by 2030. The interventions that we need to do to accomplish this goal involve first providing education on recognizing and avoiding abusive situations. What does this look like? This can look like making information more available to both the general public and target audiences, specifically research suggested school nurses possibly providing information to adolescent girls in middle schools. This also includes the development of screening tools and awareness of risk factors across all health practices. Our second intervention is to remove current victims from abusive situations and relocate them to safe housing. This can be achieved by advertising and referring survivors of sex trafficking to community resources, including food pantries, housing options, and transitional programs, along with employment opportunities. The safe removal of victims of sex trafficking from abusive situations necessitates intentional intervention and solid rapport with your patients, and in general, knowledge of trauma-informed healthcare. And finally, there's a huge emphasis on the interdisciplinary collaboration of health practitioners involved in the removal process of survivors from abusive situations. This can include social workers, community leaders, mental health and crisis professionals, even law enforcement.
All right, next we'll be looking at the evaluation of the intervention outcomes. The first two talk about the short-term goal evaluations. So the readiness for community learning, looking at how many of the population members are using condoms and the STI pamphlets, and then identifying positive STI screening, so how many individuals are willing and have the needed resources to seek treatments and receive those treatments as well. And then looking at the third one, examining population involvement in available resources. That touches on the long-term goal, which is decreasing the rate of homelessness for victims of sexual trafficking in the Pearl District. So we can evaluate this by how many members of the population are currently using the resources that are there. And then another way we could evaluate is looking at survivor stories. This can show useful ways for actual accounts of sex trafficking, for make that really personal and see how people were benefited through these resources. And then next up are our references that we used for this project. Yeah, thank you for listening.